Good day. My name is Yanay Marie Pacheco Torres. I am an aspiring student for a master's degree in applied and integrated neurosciences in the clinical branch of the Pontifical Catholic University of Puerto Rico. Today, I will talk about my project, the baroreceptor's role in the cardiovagal control in patients with postural orthostatic tachycardia syndrome, also known as POTS. This project was carried out with the mentoring of Dr. Marisol Camacho Santiago and the collaboration of Dr. Jose Criado del Valle from the Scripps Institute. The sympathetic system and the parasympathetic system are part of the autonomic nervous system. Of the multiple processes that both systems have, we're going to concentrate on the cardio and vagal areas. The parasympathetic system produces a reduction in the heart rate and the bronchi contracting, while the sympathetic system is responsible for increasing the heart rate and dilating the bronchi. The synchronized work of both systems produce homeostasis. To see what the change in functioning is, we must take into account what is the normal orthostatic response. When the person changes from a supine to upright position, blood moves to the pelvis and lower extremities. The central orthothoracic intravascular volume decreases as well. To maintain optimal blood pressure, you need to make quick adaptations. Feedback mechanisms are divided into positive and negative feedbacks. Both promote homeostasis. For a normal orthostatic response, the reaction mechanism corresponds to the negative feedback type. The vagus nerve is responsible for both the afferent message and the afferent response. If this nerve does this effectively, we have balance or homeostasis. If not, we see the beginning of POTS. Let's now look at the complete nerve route. The first nerve impulse is sent from the baroreceptors in the aortic arch and carotid sinuses. These pressure sensors send an electrical impulse to the medulla oblongata, specifically the nucleus of the solitary tract. Here, the electrical impulse continues to neurons in the brain stem, specifically. There, the instructions or the afferents is produced, that is, a signal to lower the parasympathetic electrical flow in the heart. When this happens, the sympathetic system increases its activity, giving an additional example of homeostasis in humans. If the parasympathetic system goes up, the sympathetic goes down, and the opposite. As the sympathetic activity increases, vasoconstriction in the arteries and tachycardia in the heart occur. Another mechanism in the heart rhythm is respiratory sinus arrhythmia, or RSA. The respiratory sinus arrhythmia is the variation in the heart rate that accompanies breathing. The heart rate increases during inhalation and decreases during exhalation. It is one of the several oscillatory mechanisms identified in the heart rhythm. These oscillations often overlap one another and produce a complex pattern of natural rhythms. Respiratory sinus arrhythmia also is used as an index of parasympathetic tone. Now, we enter one of the most important variables for this study, postural orthostatic tachycardia syndrome, also known as POTS. In one of his articles, Raj defines it as the presence of chronic symptoms with intolerance to the regulation of the blood pressure at a rapid rate. One of the indications that the person has the syndrome is if the heart rate remains at a rise of 30 beats per minute during the 10 minutes that the person remains in an upright position. For example, if an individual whose average pulse is 7 beats per minute, and when in an upright position, it remains 100 or 100 beats per minute, after 10 minutes of holding this position, they have POTS. In this image, we can see another feature of POTS. When standing, the blood flows through the gravitational center, that is, towards the lower extremities. The normal response will be for the vein valves regulating this flow to the chest and the upper extremities. If that were the case, we will see the normal skin color as seen in the individual on the left. However, and I want you to focus on the left and the legs on the right, their skin is reddish. Why? This is the research question in this project. Could it be that the baroreceptors connected to the afferent branch of the vagus nerves are not capable of producing the signal? Could it be that the effectors, also being the vagus nerve, are not capable of producing an adequate response? This investigation is trying to answer this question. In POTS, there are three types of pathophysiological mechanisms: neuropathic POTS, hypovolemic POTS, and hyperadrenergic POTS. These led to signs and symptoms of POTS as seen in the image: fatigue, sleep problems, drowsiness, increased norepinephrine levels, presyncope, palpitations, nausea, tremors, anxiety, and mental clouding. The pathophysiology of neuropathic and hypovolemic POTS is consistent with reduced Brennus return and reduced stroke volume, before cascading down to the baroreceptor unloading, increased sympathetic nervous system activity, tachycardia, and impaired cerebral perfusion. The pathophysiology of hyperagenic POTS merges with the cascades in the increased activity phase of the sympathetic nervous system. The focus of attention of this project will be in the first two divisions. We continue to delve into the psychological effect of POTS. Sadly, this syndrome is misdiagnosed for anxiety most of the time, as it has similar symptomatology to a panic attack. But when they look at the results for the general population, Raj indicates that the incidence of major depression, drug abuse, and severe anxiety disorders was the same as for people who also have POTS. This may be due to the fact that there are similarities in the nerve paths, since both synapses in the nuclei are similar. Note the direct connections of the solitary tract nucleus to the amygdala, hypothalamus, and thalamus, remembering that the amygdala mediates emotional systems. Although not shown in the picture, there's also emerging evidence that there's a pathway for the dorsal-vagal complex that travels directly to the frontal cortex. We will explore this more in the future. Now, why this investigation? Well, the general objective of the study is to identify the role of baroreceptors in the cardiovagal control in these patients. For what? Well, because we understand that this information will lead us to identify non-pharmacological interventions for the POTS condition. For the methodology, the research was mostly conducted with a standardized autonomic reflex projection protocol at the Autonomic Laboratory at the Scripps Clinic in California. It is made of 90 subjects, 82 women, and 8 men, with an age range of 18 to 15 years old. Patients avoid consuming caffeine, alcohol, and smoking 8 hours before the study. The data distributed includes the systolic blood pressure, diastolic blood pressure, heart rate, electrocardiograms, and evidence of the presentation of POTS. As an exclusion criteria, the profiles of participants with bradycardia are withdrawn, with also participants who have a heart rate of 90 beats per minute or more in the supine position, and participants who use vasodilators and vasoconstrictors since it affect autonomic function. For a protocol, it's established specifically in measurements obtained while the patients were in supine position before the head upright tilt table test, or HUT, during the sit test as well, and a minute after the patient will return to supine position. Patients were in supine resting position for 30 minutes, and baseline records were obtained for 5 minutes. The respiratory rate will be determined by calculating the number of breaths during 1 minute while the patient was in supine position, and then after 9 minutes in the tilted position with the head up. As various instruments and techniques used in this research, we're gonna talk about the HRV Acquire, who was used to measure heart rate and respiratory rate. The BMI Nexus device was also used to measure blood pressure, beat by beat. The heart rate and to beat by beat blood pressure and respiration recordings were obtained using the WR Testword software. Brachial arteriosystolic blood pressure and diastolic blood pressure was also obtained with the Welch Allen Connex 6400 sign monitor. Statistical analyses are currently being performed. And with all the references shown, this is the end of my project presentation. Thank you for your attention.